Hey, everybody, a really awesome study just came out about vitamin D protection against metabolic syndrome. I'm Dr. Julie McLaughlin from McLaughlin Care, and you're probably saying, what is metabolic syndrome? Well, metabolic syndrome is a condition of a combination of a bunch of things that is a forerunner to heart disease and diabetes and stroke. Like, I don't want that. I don't want to sign up for that. So let's figure out what we can do with this vitamin D to try to reduce our risks. So first thing is, what is metabolic syndrome? So there's 5 risk factors. If you have 3 of these 5, you most likely have metabolic syndrome. So let's go through them. The first one's high blood pressure. If your blood pressure is higher or equal to 30/85, that's one. If your abdominal obesity, right? So if you measure, take a tape measure and you measure at your belly button, in women, if it's more than 35 inches, that's abdominal obesity. In men, if it's over 40 inches, that's abdominal obesity. If you have elevated blood sugar, if your fasting blood sugar is above 100, that's an issue. And altered blood fats. So blood fats are going to be like your lipid panel, your cholesterol, and your triglycerides. So if your triglycerides are higher than 150, you're going to have an issue. If your HDLs, your good cholesterol, are less than 50 in women or less than 40 in men, you're going to have an issue. So if you have 3 of those 5, you may have metabolic syndrome. But the good news is that more vitamin D is decreasing this. They did the study at University of Minnesota in Minneapolis, and they studied about almost 5,000 people over 20 years. And they were studying the connection between the vitamin D and the metabolic syndrome. And the good news is, and there was about a 20% decrease in the people who had the least deficiency of vitamin D, right? So if you're consuming vitamin D, and if you didn't check out my video on vitamin D, because I go into a little bit more depth about the hows and whys and what's on there, definitely check that out. But this study showed that the contributing literature, body of literature that's out there, that is definitely beneficial to take vitamin D to help prevent chronic disease. And it could be definitely a potential strategy to help prevent cardiovascular disease and the risk factors. So beyond, increasing your vitamin D, what else can you do for metabolic syndrome and kind of keep that off? Obviously, maintaining a healthy weight is always going to be important. Definitely keep moving, keep exercising. It's great for your cardiovascular system, your bones, your joints, and make sure you're eating right. Make sure you're eating a balanced meal and that you have all the nutrients that you need. That's it. If you have any questions, type them in the comments below and feel free to subscribe and share. See you next time.